New nurses, let me help you today. If you've ever felt anxious about giving reports to the oncoming nurses, or whenever you give reports, you realize that after the reports you remember some hot or important things, this is for you. And if you want to make your report templates get better, this is also for you. So today I'm going to give you a simple yet thorough, confident and professional template on how to give a professional report every single shift. So I'll divide it into different parts, and let's start with part 1. That is the patient basis. This helps you to set the tone. You start with the patient's name, their age, the room number, code status, primary diagnosis, if they have any allergy, date of admission, recent surgeries and procedures, and ongoing treatment, IV therapy, wound care, or continuous feeding, the ongoing treatment. You mentioned that is your basics, and you do that very fast within 30 seconds. So this tells the oncoming know about the person they are taking over from you. It just gives them a picture of who they are taking over from you. Part 2 is the system. So you go system by system. This is the main body of your TOA. And this is where you shine as a nurse. You go from the neuro, you tell the oncoming nurse the patient's A and O level. If they're alert oriented ×4, you let them know their behavior, their pain level, and the delirium risk. So from neuro, you go to respiratory. Is your patient on room air? Are they on oxygen? What does their lung sound like? Is it clear? Are they wheezing? Those are the things you need to tell the oncoming nurse. Is there any recent DSATs? Or what are the respiratory treatments you're giving to your patients? Then from there, you go to cardio. What's your patient heart rate, their blood pressure, typically the all vital signs. Do they have any labs, their troponin or BNP if it's relevant? For me, recently, the facility I work in, the CNAs will typically do the vital signs. So as a nurse, you are responsible to check the vital signs. Are they normal? Are they not normal? You can always go back to check the blood pressure just to make sure you guys are on the same page and your patient is safe. And from then you go to your GIGU. How does your patient void? Do they have a Foley catheter? Are they continent? How do they have a urinal by the bedside? Do they have to use the bedpan? When was their last bowel movement? What was their output, if that is necessary? If you are on street, intake and output, your I and O. So you also have to let the oncoming nurse know about this information. The next one is mobility. So how does your patient move? Are they totally independent? Do they need Boya or Sarah Steady? Are they one person assist or two person assist? Are they for risk? If your patient is for risk, typically you make sure that bed alarm or chair alarm is always on, and they also have a risk fall band, so anybody that sees them, we know this patient is high fall risk. And then you go to skin. Ideally, after or during admission, you're supposed to check your patient's skin from head to toe. Do they come into the hospital with any pressure sore or any old wounds that they did not get in the hospital? If they do, you have to document that in your LDA avatar. For those that use EPI, you have to let the oncoming nurse know about the wound too. So is your patient's skin intact? If they have any opening or any wound that is open to here, those are the things you need to let the oncoming nurse know about. So this structure I just gave you will prevent you from skipping important details of your patient. The third part is when you talk about your patient's medication. So what are the scheduled medication during your shift? Did you have to give any PRN medication? What are the PRN medication that we're giving? Is your patient on IV fluids? Are they on isolation status? How did they take their medication? Is their meds taken old? Do you have to crush in applesauce, or do you have to crushed in thin liquid? That's water. So because some patient would not, depending on the SLP assessment with them. So how does the patient take this medication? You have to let the nurse know. Are they NPO? What's their diet like? General diet? Is it cardio or renal diet? Are they on continuous I and O monitoring? The fourth part is the event during your shifts. So this is the part most nurses forget to mention, and is very important. It's the most important part of your TOA. What happened during your shift? Are there any fall, or are there new tests or labs that were done on your patient? Did you get any critical reports? Did you have to tell the physician if in case you got any critical report during your shift? These are the things you need to let the oncoming nurse know, so for smooth continuity of care. Any change in condition during your shift? Did you have to call the physician? Did you have to call the pharmacist to help you adjust medication, maybe antibiotics? I have had to do that. So you just don't give antibiotics anyhow in case there's a missed dose. You have to let the pharmacist know about it. So did you have to call pharmacy? What was the outcome of the call? And all these things I'm telling you, especially when you have to make calls, you need to put it into documentation. If you don't document it, it did not happen. So always have that at the back of your mind. Anything you discuss, especially on call with physician or with any healthcare provider or professional, you have to document it. Are there new orders? Are there new consults? Maybe consults to the psychiatry, consult to orthopedics, consult to SLP. Did you make any consults? If there are any consults, all this you have to let your oncoming nurse know about it. The part 5 is your pending tax. You have to let the oncoming nurse know about your pending tax. Are there things you did not do that you would love the oncoming nurse to do? Because honestly, sometimes you can't just finish everything during your shift, but you have to be accountable. That is why it's called TOA. You have to be accountable for it. And this is where you make sure medications that were not given or medications that were refused by the patient. Did you call the physician about it? If the medication was important? Are there labs you did not do, especially for night shift nurses? In my facility, we don't have to take blood. We have phlebotomists to do that for us. But in case where I was working in Canada, nurses have to take the blood by themselves. So was the patient sleeping? Some patients don't like it if if nurses have to wake them in the morning for blood collection. So usually if I see that I have blood sample taken from my patient in the morning, or blood sample to be taken from my patient in the morning, I usually ask them before they sleep, I might have to wake you around between 6 to 6:30 for your blood work, or between 5 to 6:30 depending on what time. Would you want me to wake you, or would you like to take it later during the day? Some patients will mind. Some patients will tell you, I might not be sleeping. Some patients will, it's fine, you can wake me, that's okay. But some patients tell you, do not wake me. Some patients will even tell you, don't wake me for pain medication like Tylenol, do not wake me for that. So you have to know your patient, and all this information are what you need to tell the oncoming nurse, especially the things you did not do. This would save your license. You don't want to lose your license after a whole lot of work you've done to get this license. Part 6 is the question part. Always give the oncoming nurse opportunity to ask you questions in case they are not clear with the report you've given. Give them opportunity to ask questions. This will also ensure a smooth and safe continuity of care for your patient. Remember, our patient safety is our priority always as nurses. So if the oncoming nurse is asking you questions, they are not attacking you, they just want to be safe, just like the way you are trying to save your license and you're trying to provide the right care for your patient. If you have any question regarding TOA, put it in the comment section, and if you feel like there's something we need to add to the TOA, also address it in the comment section. Thank you for watching my video. I'll see you in my next one. Bye. What's that? Do you want to talk? No. Me, Juro, want to be a video.